Great to see you, Mr. Drysdale. How are you?
Hey, Mark, it's great to see you again. I'm doing just fine, thanks.
Yeah, it's we were just chatting a little bit about anything and everything that's been happening the last few years, and hopefully we learn from it. And I think we're going to learn a lot about some great things that you're doing. So I really appreciate you being here and on our Leaders in Care series. And because we do believe that that leaders do need to care more. It is up to leaders like us to make the difference. And you can actually do better in business if you do good at the same time, basically. So you're doing that. And I'd love to start, if you could, with briefly introducing yourself, where you're from, family, and things like that. And then we'll get into it.
Sure. Yeah, thanks for the opportunity, Mark. So look, I grew up in the UK and I have been in the pharmaceutical sector for 32 years. Spent the first decade of my career there in Europe and the last 2 decades here in the US. Grew up in a relatively big family, 4 sisters, all younger than me. They're all still there. So we have that back and forth across the Atlantic from time to time. Spent the first half of my career largely on the commercial side of the industry, so sales, marketing, business development, M&A, and then the last half being an executive leader, so the CEO of 4 different pharmaceutical companies, two private, 2 public, but then a whole range of different parts of the industry too, from spec pharma to generics to CDMOs to biotech, so pretty broad range. I've been at Cybin since the middle of 2020. Started learning about Cybin and psychedelics right at the beginning of the pandemic, and just got really intrigued by the potential, which we can talk about, the potential of what these treatments can do.
Yeah. So did you start learning about psychedelics during lockdown? I want to know some clarity.
Well, like all of us, like many of us, I was in college at one point in my life, and also I'm a scientist, right? So I've always known about these molecules and was fascinated by things that were going on in the 50s and the 60s that never really kind of went anywhere. They just ended, and I guess because of my age, I wasn't really conscious of why that all ended, why they didn't become sort of mainstream treatments. And of course, now looking back, we all know it was the war on drugs and a lot of the misinformation that kind of put a big hold on that for many decades. But there's still we learn a lot about them, and we can leverage that going forward.
Absolutely. Let's learn about it. So you're in Cape Cod now, you said, right?
I'm in Cape Cod, beautiful Cape Cod, which is a bit of a change from the city where I lived for a long time. But it's been a great place to be, during the pandemic, a very healthy place to be, lots of fresh air. And it's pretty close to Boston too. We have a lab there, so it's pretty convenient for that.
Yeah. So you have family up there or what?
My wife, who I met on Cape Cod, but my family's all in the UK, primarily, friends and family. Yeah.
And 4 sisters. So were the younger sisters, they were setting you up with girls back then or what?
Yes, they were younger. They are younger still, of course.
Of course.
And they went from being annoying when they were younger to being needed to be protected when they were older. That was my view, I think, back then when I was the older brother and they started having boyfriends. But anyway, seems like a lifetime ago.
Yeah, time does go fast. I mentioned to you, I have a 94-year-old aunt, kind of like the second mom in Montreal. I speak to her every Sunday, and she said to me a couple of weeks ago, she said, "How does 94 years go by?"
Mm-hmm.
Fascinating comment. It's like, you just can't even imagine it for real. So yeah, time does fly. So before we do delve, further, your education was in biology for the most part. Although I did notice, being a sports fan, you were a sports officer. Interesting title there too. I want to know about that. Share with us that infamous why, when you discovered it, or did it change, and why do you do what you do?
Yeah, so I was always interested in kind of the human body, what makes us tick, what's going on in there, in high school. I was always fascinated by it. And when I went to college, studied molecular biology primarily. And again, these were like the building blocks of life. And at that time, PCR had just been discovered. So we were on the verge of all these incredible breakouts, and we're on the verge of gene therapy 30 plus years ago. And now, of course, it's starting to become a reality, but this shows you how slow sometimes science can be to turn from an idea into something else. But it was really, sort of always wanted to learn more about what was going on. The sports officer thing was just a bit of fun. Actually, I was always athletic, and it was my first and only ever elected position that came with a lot more hassle than fun at the end of the day. Our team, we had about 10 or 11 staff that managed all of the intramural sports for the university, which is just a massive, complex thing, and actually nothing to do with sports at all, just organizing stuff. But no, how I got into the pharmaceutical industry was kind of like many things in life. It came out of a bit of adversity. Like I said, I was really interested in science. I did what I thought was a great research project in my final year. Applied for a couple of PhD positions, and then right in my final year, right at the point I was taking my final exams, my mom died. She had lung cancer from smoking, so an addiction, and very quickly, within a couple of months, went from diagnosis to being gone. And I just changed my perspective on things. At that point in time, at that moment, I didn't want to be working in the theoretical, and doing a PhD. I wanted to get out and do something, take some action. And that meant joining a pharmaceutical company. I thought that I could do two things. One, I could be out there educating physicians and helping get medicines to people. And two, I was also, I was terrible at presenting, as I found in my final year at college. So it forced me to present 8 or 10 times a day. I remember that being one of my motivators. But yeah, it's funny how things come along and change your perspective. I was all ready to stay on the bench for a number of years, but just that bit of adversity meant that I just wanted to get out there and take some action and do something.
Yeah, it's pretty amazing how things like that can motivate us. And I'm there's always the conversation about pharma's everything from charging too much and keeping you on drugs till the end of time, and then you'll get a Gilead and maybe invent something that's a cure and whatnot. And then you need R&D, which costs a lot of money as well. So what's your thoughts on how pharma's looked at in general? I'll get specifically to Cybin in a minute, but how pharma's looked at in general of doing that, of making money to keep people on these things forever, but still needing to do all the stuff they do to make our lives better.
Yeah, that's one of those things that I've always struggled with socially, is that I've always been very proud of what I've been involved in and the projects I've been involved in, whether it's been R&D or generic drugs. But when I meet people outside of the industry, they have very mixed views of pharma. There's a lot of misinformation around it, and what we also suffer, in an unbalanced way in the US as well, in that the US pays for pretty much all of the world's R&D largely because of the way we price drugs here. Pretty much everywhere else in the world, pricing is set by governments who are the sole payers. We have a free market in the US, but it means that drug companies that have spent billions of dollars developing something novel and life-changing, maybe even curative, which is tough, right? They end up having to recoup an ROI from around the world, and very few drugs actually make a profit from if you include all of the R&D costs and the failed R&D costs. So it's a difficult thing now, but also misinformation. That it's all the drug companies' fault. And reality, health drug prices are maybe 8% of the total cost of healthcare. And so going after the drug companies, going after pricing is only a small part of the whole picture. And you mentioned Gilead. I mean, it's an interesting situation where you have a company that literally developed a cure, and then was really beaten up on pricing and ended up giving away half the price and discounts to middlemen, right? PBMs, etc. So it's a complicated environment, I think, for the general public to understand what healthcare is. Frankly, I could go on and on about it, but I remember when Obamacare was being drafted, this very, very large bill. Reading through it, it was clear that politicians didn't understand it either, and they certainly hadn't come up with the solution to it. But no, I've always been motivated by that, and I early on in my career was in more R&D based companies, and got a little frustrated, I have to say, with just how slow R&D can be. Even R&D licensing in bigger companies can just take such a long time, and was part of my reason I jumped into the generic sector for a while. I was in generics for a decade, and just the speed at which drug development can be done there, approvals can be done, distribution channels can be set up, and suddenly you're leveraging your portfolio into 50 or 60 or 70 countries and really improving access. So there's lots of different ways in which the drug industry can help folks. It doesn't all need to be about R&D. Sometimes you can find great solutions from old molecules as well.
Yeah, we see it live and in color with the warp speed of the vaccines, right?
Right.
I mean, if there was lots of time, we would just be taking time to make sure it's perfect. And I remember seeing an interview with the fellow that's the CEO of Pfizer, and he was motivated by what happened in his life in Germany and et cetera, to do. And he said, I just took down all the red tape, the bureaucracy, and made the decision come right to me, and bam, let's just do it. So I kind of get what you're saying, and it sometimes takes urgency to get us to be urgent, if you will.
Yeah, and in that situation too, it wasn't just Pfizer, was it? I mean, so if you're developing a new drug, and you've got to plan ahead for commercialization and ramp up distribution, ramp up manufacturing, ramp up packaging, all these things that take a lot of capital. They were fortunate, them and other companies, that the government basically paid up front and enabled them to do that, enabled them to build scale at risk, and also took away some of the potential liabilities that they had through indemnification. So the government helped, in partnership with pharma, helped take down a lot of those barriers. It's a great example. I mean, I just hope that we can do that again if we ever need to.
Plus, it also shows there was a whole bunch of research done for years that they didn't necessarily know it was going to be for a pandemic, right? And it helped, if I'm not mistaken, right?
Yeah, it wasn't like mRNA technology was developed for the COVID vaccine. I mean, it was there and existed for quite some time, and the slow process of clinical studies makes that challenging. But I have to say that the sheer scale of studies that were done, the numbers of patients that were studied, quite unprecedented, because it's not like we cut any corners. FDA still went through their processes, but these studies, often with large scale, tens of thousands of patients, take a long time to do. And just the scale at which these companies, especially Pfizer, were able to ramp up was incredible.
Yeah, no, it is incredible. So let's go specifically now to Cybin. By the way, where does the name come from?
It comes from psilocybin, as in the active ingredient in hallucinogenic mushrooms.
Thought so. Okay, cool. So, we talked about 30 years or whatever between cannabis and psychedelics that no one was allowed to even say the word or whatever, or at least take good pieces from it even versus bad, and whether it's what it was for ideologies, politics, who would have thought politics would be involved, and disinformation, and et cetera. So share with us why you're excited now about how Cybin literally can revolutionize mental illness, which is prime time, a big urgency right now.
Yeah. So the two parts of that. The first is, as I was just talking about, how R&D just takes so long. Well, the benefit of many of these classical psychedelic drugs is that we've known about them for 60 or 70 years. So there's dozens and dozens of academic studies, human data. We know about metabolism, chemistry, the toxicology, so we can leverage all of that. And that's definitely de-risking and accelerating our development. So that's a huge bonus from what's happened in the past. But what got me most excited is, honestly, like I said, I've been in pharmaceuticals for 30 plus years, and I don't think there's ever been an opportunity to make such a dramatic difference in such a short space of time. These molecules have the potential to be game-changing, literally a paradigm shift. When you think about how we treat mental illness today, whether it's depression or it's anxiety disorders or addictions, we're generally giving someone a chronic daily pill.
Right.
That sort of works, some of the time. It's certainly not a cure in any circumstance. Often takes a long time to work. And as you said before, people are taking them often for many, many years and never really get off them. They're a bit like, chemical handcuffs. These treatments work just so dramatically different. It's hard to overstate, how different it is. And we've seen this in many academic studies, so not just theoretical, not just preclinical work, but in academic studies in patients at Johns Hopkins, NYU, Imperial College. We've seen patients be free from their depressive symptoms or their addictive cravings for maybe 3, 4, 5, 6 months at a time from just 1 or 2 doses, just 1 or 2 treatments, and not having to wait weeks or months for the treatments to work, like say with SSRIs. Very rapid responses within a day, and then really robust effects that can last for months at a time from just 1 or 2 treatments. That is completely game-changing. It is completely game-changing in depression, where many people get benefit from SSRIs, but also don't really feel joy either, even though their depression may be handled. They're kind of in that state that their emotions are being managed. And when you think about addictions, where there's really nothing that works for addiction that's particularly effective, and you're always constantly fighting the addiction every day with whatever treatment you're giving, and ultimately the addiction ends up winning, and patients end up relapsing. But here, if you can intervene with a treatment like this that takes away someone's addictive cravings for weeks or months at a time, that's an ability to completely change the direction of someone's life.
Yeah, to me, it's amazing. And if it lasts for 3, 4, 5, 6 months, does it have to be continued then, or does the body kind of say, "Hey, this is where I want to be," and maybe do it by itself, or do you have to keep going?
Yeah, good question. So those studies are quite hard to do because measuring longevity like that means keeping patients in a study on the active and the placebo for all that time. And it starts to get unethical, keeping someone that's depressed on a placebo for many months. So we do need to do those studies. But my expectation is that the brain is that we will need to repeat those. And that duration, that interval, is likely to change between some patients or between disease states or severity of disease. And the reason I say that is that the brain is designed to create habits.
Right.
And we create habits for simplicity, so we're not having to relearn things all the time. For our self-protection, we have habits, so we just do so many things on autopilot. And so the brain is designed that way. It becomes a lot more efficient if you're not having to rethink how to pick up a cup, or how to ride a bike. And so these treatments provide a period of temporary neuroplasticity that helps reset those habits, or reset our ruminating, or reset the way our thought patterns. But those are likely to return eventually, just because that's how the human brain works. But still, if that's the case, that patients can get by without any symptoms for months and months at a time from a couple of treatments, I think a lot of people would give that a try.
Absolutely. I mean, the alternative is stay depressed or stay on drugs forever and all that. No, it's fascinating. And you're right. Well, I'm not a brain expert, but actually our new partner who leads our whole well-being practice, who I'm going to have you meet, knows a lot about the brain too, and it is trained to protect us to the point where sometimes we have to tell it, I want to take this chance. Don't protect me so much, type of thing. That's why I asked. I wonder if the brain sees this is cool. I'm feeling better. Maybe this is the way we should go. Kind of like retrained or whatever.
Yeah, but I suspect temporarily, but temporary might mean different things for different people.
Right.
You know, temporary might mean 3 months for one person, and we've seen in a couple of studies maybe a year for someone else. So it really does depend. It may depend on the nature of the underlying trauma that is causing the addiction or triggered the depression. So we don't really know what temporary means. But some really exciting data, and now our job is to turn these classical drugs that we've known about for a long time, turn them into real therapies.
Yeah, to me, it's super exciting. I mean, well-being, mental health is a huge issue. It wasn't a big issue before COVID. It's a bigger issue even now in so many ways. And so it's I can't wait to hear more about it. I do want to ask you. We talked a little bit about impact before, and thinking decades as well for leaders and companies to realize that they have a responsibility. They can actually do good, and as you said, the business can do better. You've built companies, you've built teams organically, acquisition, you name it, globally. What's your perspective on how, not to be cute, leaders who care can actually make economic and social impact at the same time?
Oh, I've always thought that empathy, kindness is a superpower. It's hard for people to overcome that. People can be angry, people can be hateful, but you kill them with kindness. It's hard to overcome that. But also, I've like many people during my career have had to make tough decisions. Businesses don't always do well; they go through tough times. And when you have to reduce your workforce or lay people off, doing it with empathy and respect and kindness and treating people well goes a long way. I've had to be in that situation, and I've had people come back years later and ask to come work for me again. But also, you're telling the people that get left behind in that situation just what kind of a person you are and what kind of company you are. And so always doing the right thing is always important. One thing I've noticed at Cybin, and I've always known, but it's great to see it, is that having a purpose that people can really get behind and believe in makes such a big difference to productivity as well, and just what we can get done. I've been in companies where they've had really great goals. We want to be number 3 by next year, or we want to have sales of $3 billion in 2 years' time, or whatever the financial goal might be. And for a few people that's motivating. For people at the top of companies who may be rewarded or bonus on those things, that's motivating. But for many people further down in an organization, it's hard for them to relate to that. If you're a lab scientist, if you're in regulatory affairs or quality, how do you measure, how do you get a sense every day that what you're doing is making any difference to that goal? But when you have a goal that's or a culture that's based around making a difference in the world, that's pretty easy for people to get behind. And as we've grown the company, there's about 5 of us when I started in mid 2020. We're up around 60 now, and every one of us had some interaction with mental illness, whether it's personal or family or friend or loved one. And so that was important to us. That was a kind of common motivation in amongst that small group. But every single person that we've hired, exactly the same, kind of a bit self-selecting maybe, but every person we've hired on the Cybin team has had some experience with some form of mental illness, either personally or indirectly. And that's not really a surprise, given there are about 1 billion people around the world suffering from these conditions. Yeah. So that common sort of motivation, that energy, gosh, it's incredible to see just the amount of enthusiasm and power that is behind that. Meetings that we have, honestly, in the company aren't like working at all. It's like almost like being at a non-profit full of people that are just highly motivated by what they do, not what they're being paid. And it's pretty incredible to see.
Yeah, and it's not really rocket science if you think about it. Why it took so long for us to get this is people want to belong. That's the number one thing that fills people's hearts and souls. And if you want to belong and you love who you're working with, and as they say, if you love what you do, then it's not work anyway. It doesn't take a genius to figure out that's probably good for business, also.
It's right. But it's harder to do necessarily than to think about. And it's definitely, I've learned from experience, it's definitely harder to change cultures than it is to create cultures. So we were fortunate to have a bit of a blank slate and a pretty incredible purpose from the outside.
Like renovating a house, sometimes easier to just tear it down and start over again type of thing.
Yeah.
Exactly. One of the more popular positions that we're getting asked to search for these days is the chief well-being officer, actually, showing a commitment to the well-being of the people there, which means it's easier to attract and retain the people there because they see, wow, they really do care about this. So
totally. That's great to hear. That's great to hear. And it's good to have someone responsible for that, but it has to be systemic. I think it has to be okay for everyone to look out for each other and for us to call each other out. It can't be one central person, kind of like the empathy police. It has to be cultural, I think. Otherwise, however well-meaning, it's hard to sustain.
Well, I compare a lot of things to sports. That's why I saw the sports officer thing there. And the teams that win championships, they trust each other. They talk to each other in a way because they trust each other. And everybody's part of that community. And it's a good feeling when you get it. It's a good feeling. And so you're right. It's not up to one person. It's never up. In fact, I did an interview with a great CEO just over a year ago now. And he said to me, I'm having the best time being a CEO because I'm more vulnerable than ever. I don't have to pretend to know everything anymore.
Yeah.
It was brilliant. So speaking,
that's quite enlightening, isn't it?
Yeah, it is. And talk about reducing stress too. And with remote, it's turned out trust has become a real positive because people like to feel that their boss or their partner trusts them to do something. And when you're working remote, you got to trust them more because they're not right there. So in a way, there were some positives to that.
Absolutely. The pandemic has killed micromanagement. Right. Absolutely has. You just got to let people get on with it and do the work.
And great people will do better, much better by that. It's like, again, an athlete. Well, my coach he argued to the referee about me. He really believes in me. I'm gonna go do it now. So, hey, my grandparents, who, by the way, were from Kyiv, as well as my mom and my aunt and everything. And again, it's horrendous what's going on there, the history and everything. But they would always say to me, as long as you have your health, that's the most important thing. And it wasn't branding. They weren't branding. They were like talking, real life stuff. And I'm just wondering, with everything that's gone on, COVID, technology zooming along, racial justice, you name it, wildfires. Have you seen, if you will, an awakening of people of what's really important?
Oh, I wish I could say wholeheartedly yes. Definitely there has been some. Yeah, I do think so. And but I think more than anything, I think there's been a heightened awareness. Sure, we've had technology for a long time. We've had rapid communications for a long time. But it seems to me that the last couple of years during the pandemic, the speed and the transparency of communications has accelerated even further. Maybe we've just got more used to being kind of on screens. But I think what that's led to is an inability to hide. It's hard to hide or harder to hide bad behavior. So I think that's led to, a kind of forced awareness. Much of it good, but some of it just driven by that kind of increased communication. I think. But I'll take it. I'll take it either way. But I think one thing that the pandemic has also showed us is that, yes, our health is important, but perhaps it's shown us that our mental health is even more important. Without good mental health, we don't have good physical health. The two kind of go hand in hand. You can have good physical health and bad mental health. You can't have bad mental health and good physical health. It doesn't really work that way. So I'm hoping we can take a lot of what we've learned and keep it going and not get back to old habits too quickly.
Yeah, and let people really express themselves. Don't call in saying I got the flu, but they're really depressed because they don't want it written in their HR report
Right.
or stuff like that. And it's
And we're not there yet, Mark, at all. There's still the stigma. It's still not okay for, say, a CEO to stand up and say that they're fighting with depression, because immediately there'd be a question of competency. So the stigma's still there. Yes, we're more aware, we're more open, and that's a good first step to doing something about it, about the problem. But we've got a long way to go to overcome the stigma, I think.
yeah, no, I think you're right. We just got to keep working at it because it's the great resignation, if you will. It's part of that. People want to do something where they're feeling good and so on. So last part of this section here, with everything that happened, and I remember in 2021, a client told me about. He said, "This is what I think about 2020. It was the year that flew by slowly." And that's an interesting comment to say that way. But 2020, 2021 was kind of hybrid. 2022, we're here. It seems we're going. Can you give me a sense of what you're most grateful for, as well as what you're most hopeful for?
Definitely grateful, thankfully, for my family, my friends, my circle, colleagues. For the most part, not 100%, but for the most part, we're all doing okay. I think for the most part, we've adjusted pretty well, and we've figured out a new way to live and survive and get on with things. So we've come through it okay, and I certainly, as long as we don't have another wave of pandemic right now, I think that we're mostly in good shape. So grateful for that, for sure. What am I most hopeful for? I'm hoping that we can not go back to the insanity of business travel that we had before.
Right.
You know, I can tell you, I spent many years being out of the country for maybe 75% of the time. I've flown to Europe for a dinner meeting. I flew to China once and didn't even have a hotel room. Flew in, had a meeting, had a dinner meeting, then flew back to China. You know, now I'm looking at meeting requests, say, to go to New York for a lunch meeting, and thinking, you know what, that's a whole day round trip. I'm just not going. I can take a phone call or a Zoom call. And I hope we can stick with some of that and prioritize some of the unnecessary strain that we put on ourselves and the stresses we put on ourselves, and be a lot more efficient. Frankly, good for us and good for the environment as well.
I second the motion. Well said. Because it's good to meet in person. Obviously, there's a big plus to it, but you don't need to be running like maniacs all over the place. Hey, I'm super thankful for you being a leader who cares and doing some great stuff. I can't wait to keep getting updates on Cybin and where you're going, and support any way we can. And so thank you for being on the series and contributing.
Thank you, Mark. It's great to have the opportunity to chat about it. So much appreciated.
Pleasure.